So now we will move on. We have heard a lot about SonoAVC follicle 2.0 now, and I will talk about evaluation of ovarian reserve with this technique. I have no disclosures, and at the end of the conclusion of this presentation, participants should be able to understand the definition of ovarian reserve, know the techniques available to assess the ovarian reserve, and understand the potential advantages of SonoAVC in antral follicle count. Ovarian reserve is a very frequently used term in reproductive medicine without a clear definition. It is defined as the reproductive potential in function of quality and number of oocytes remaining, but when we talk about ovarian reserve, we are talking about quantity of oocytes. We're talking about oocyte quantity, we are not talking about quality, fecundity, or reproductive outcomes. Abnormal ovarian reserve test results suggest that fertility potential has declined, but do not tell us who will or who will not conceive. We have a few ovarian reserve tests, around 7, but in this talk I will focus on antral follicle count. Antral follicle count is defined as the number of follicles measuring from 2 to 10 millimeters in an early follicular phase. It's widely used because it's very easy to perform and give us a lot of information. Okay. However, follicles are usually not measured in routine practice. Therefore, the 2 to 10 millimeter range represents an approximation rather than an exact measurement in antral follicle count. And what we know about 3D ultrasound and antral follicle count. In this study, Schaeffer in 2002 published this article where they compare manual count with with 3D count, but they count the follicles doing the scroll. They do the 3D volume and then they scroll through the volume and they count the follicles, but they didn't measure the follicles. And what they found is they demonstrated that 3D antral follicle count has a lower inter-observer variability compared to 2D. In this other study, Perez-Fecundes, they compare SonoAVC follicle, but they use it for antral follicle measurement and count. In 2D, in this study, they count and measure every antral follicle. And what they found that 3D SonoAVC, when you measure the follicles, is quicker, like 3 minutes quicker, and 3D SonoAVC count more follicles than 2D. Especially when there are more than 20 follicles, is quicker and count more follicles. So this article opened a debate about antral follicle size. Is important? Should we measure them? And antral follicle size studies are very controversial. We have these 3 studies trying to relate antral follicle size with ovarian response to stimulation. In this first study, Beso group concluded that antral follicles lower than 6 millimeters were related with low FORD, and for this follicular output rate. In the second study, Hansma group reported that antral follicles between 2 and 6 millimeters were related to better ovarian reserve test results. And in the third article, Paul group relate antral follicle size from 5 to 10 with higher predictive value for oocyte retrieve. So trying to respond to this question, Casapoglu group published this paper in 2021, and what they did, they measure antral follicles with 2D in the basal ultrasound, and then they compare the optimal response group with suboptimal response group. And when they observe a higher 2 to 5 millimeter follicle rate was higher in the optimal group compared with the suboptimal group. So they conclude that follicles between 2 to 5 millimeters are the ones that could be associated with a better response. So it seems that size could matter in the antral follicle count. And that's why SonoAVC antral tool is so interesting. It's a software developed by General Electric. It's a modification from the first SonoAVC follicle, and that improved the detection of small follicles and automatic measure the antral follicle. We can see here the report, it's automatic. We can see all the follicles with the diameter, the volume, and we can see the range too. We can know how many follicles are between 5 to 8, 2 to 5, or in 8 to 10. This range we can modify if we want. So in one click we can have all the measurements and all the groups range count. And using this SonoAVC antral tool, we present this study at R 2019. We did a prospective study with 35 women that underwent ovarian stimulation. And what we did, we compared the manual count with the count with SonoAVC antral. And our results were that there were no significant difference in the count of follicles between automatic and manual. It was higher in the automatic, but no significant difference. And the time need to assess the antral follicle count was higher, significantly higher in the automatic count compared with the manual. And the higher time in this automatic count was because of the reconstruction. But the time need at the ultrasound room was lower than the manual count. And the other thing is that in the manual count, we didn't measure the follicles. With this study, just to compare if manual and automatic count were similar, and they are. And then we start to use the SonoAVC 2.0. They use artificial intelligence-based 3D neural network that detects smaller follicles, excludes non-follicular structures, requires minimal post-processing, and performs well even with poor image quality. So we conduct a small pilot study involving 12 IVF patients, 7 at baseline antral follicle, and 5 during stimulation, periovulatory follicles. All patients were monitored using SonoAVC 2.0 and SonoAVC, the old version. And we observed that in antral follicle count, SonoAVC 2.0 is quicker than the older version, and in periovulatory follicles, it was faster too. And then we published this abstract as at ISRM 2024, titled Antral Follicle Count, an Exploratory Study Using Three-Dimensional Ultrasound where we tried to study SonoAVC follicle 2.0. We designed a study that will include 20 patients. We exclude one because of poor image quality. And what we did, we already have the volume, and we did multiplanar manual count, SonoAVC antral, and SonoAVC follicle 2.0. And it was done by one operator, and this operator did the count in each one of the softwares 2 times. And our results were that SonoAVC antral count more follicles than manual. Okay, you can see here that antral follicle counts like a median of 35 follicles and manual 23, and the results were significant difference. But between manual and SonoAVC follicle 2.0, there were no significant differences. SonoAVC follicle 2.0 is quicker than SonoAVC antral because of the post-processing. And we conclude that SonoAVC 2.0 provides accurate assessment of both antral follicle and follicle size, antral follicle count and follicle size, has minimal processing required, and short and intuitive learning curve. And this is our most recent study of SonoAVC follicle 2.0. We are not published, this is unpublished data. And we have observed that antral follicle lower than 6 millimeters show the strongest association with higher number of oocyte retrieved. Antral follicles that are more than 7 millimeters show the weakest association. And this is a new thing that we have found, that antral follicle size variability was also relevant. More homogeneous follicles size were related with more oocytes in the more oocyte retrieved, and greater size heterogeneity were related with less oocytes retrieved. So this is also a new thing, because it's not only size, but the heterogeneity of the size of the follicle may be also important. And the take-home messages are that antral follicle size matters for predicting ovarian stimulation outcomes. SonoAVC provides a more comprehensive antral follicle count than manual assessment. SonoAVC follicle 2.0 is more accurate, faster, and requires less post-processing. AI-based SonoAVC will play an increasingly important role in the future of antral follicle counting and in follicle measurements. Thank you all. And